Namaskaram. ഞാൻ ഷോഫില സമീർ, കൺസൾട്ടന്റ് സൈക്കോളജിസ്റ്റ് അറ്റ് ഉണർവ് മൈൻഡ് ആൻഡ് ബിഹേവിയർ സെന്റർ. നമ്മളിന്ന് സംസാരിക്കാൻ പോകുന്നത് അഡ്ജസ്റ്റ്മെന്റ് ഡിസോർഡറിനെ കുറിച്ചാണ്. അഡ്ജസ്റ്റ്മെന്റ് ഡിസോർഡർ എന്ന് പറയുന്നത് ഇറ്റ്സ് ബേസിക്കലി ആൻ എക്സസീവ് റിയാക്ഷൻ ടു എ സ്ട്രെസ്ഫുൾ ഇവന്റ്. നമ്മൾ സാധാരണ അനുഭവിക്കുന്ന സ്ട്രെസ്സേഴ്സിനോട് നമുക്ക് ഒരു തരത്തിലും ഹാൻഡിൽ ചെയ്യാൻ പറ്റാതെ വരുമ്പോഴാണ് നമ്മൾ ഈ അഡ്ജസ്റ്റ്മെന്റ് ഡിസോർഡറിനെ ഡയഗ്നോസ് ചെയ്യുന്നത്. യൂഷ്വലി ഒരു സാധാരണ ആയ ഒരാൾക്ക് ഒരു സ്ട്രെസ് വരുമ്പോൾ അല്ലെങ്കിൽ ഒരു ടെൻഷൻ വരുമ്പോൾ അത് എങ്ങനെ ഡീൽ ചെയ്യും എന്ന് പറയുമ്പോഴാണ് നമുക്കൊരു നോർമൽ ലൈഫ് ലീഡ് ചെയ്യാൻ പറ്റുന്നത്. ബട്ട് വെൻ ദാറ്റ് സ്ട്രെസ് ബിക്കംസ് ടു മച്ച് ആൻഡ് യു കനോട്ട് ഡീൽ വിത്ത് ഇറ്റ് അറ്റ് ഓൾ, ദെൻ യു ഡയഗ്നോസ് ഇറ്റ് ആസ് an adjustment disorder. Adjustment disorder can be seen basically in adults, and it can be seen in women more than men. And it has a lot of physical as well as psychological symptoms. Physical symptoms like headache or heart palpitations, heart racing, or a lot of trembling and shivering. And also a lot of fatigue, drowsiness, sleepiness can also be experienced in physical symptoms. Psychological symptoms include anxiety, that is like constant worry and tension about a stressful event, and also a constant crying, feelings of sadness, and how you keep on crying about the event or getting anxious about the event. There's also feelings of hopelessness, like not having any hope of what is going to happen or having negative thoughts about the event. Also, the feelings of worthlessness, that you're not capable of doing anything. There's a lot of lack of self-esteem and lack of confidence in believing in yourself. You see your worth as a very negative self-image. Psychological symptoms also include feelings of suicidal thoughts or negative thoughts of extreme pressure, and that will lead to the person believing that they're not able to live anymore because they have a lot of tension regarding how to deal with a stressful event. Adjustment disorder also impacts the way how you think, how the way you feel, the way you act. It impacts your feelings, your emotions, the way how you handle the daily routine or the daily functioning. You won't be able to do the daily activities or the activities that give you pleasure. So adjustment disorder is an excessive reaction to a stressful event. Sometimes when people are able to deal with stress, they would go very normally. But when they have to deal with something like, the causes could be the death of a loved one or moving to a new place, some natural disasters like, for example, COVID. People got really tensed and stressed because of COVID, and like floods or like health related issues, or having fights in the family, divorce, separation from parents, educational issues, financial issues, work related stress. Any kind of stressor when the person is not able to handle is when an adjustment disorder happens. And normally when people grow up, they develop a lot of social skills and coping methods to deal with the stressors on a daily basis. And based on these coping skills and the stressors that you have, or the social skills that you have, it determines whether or not you will develop an adjustment disorder. So adjustment disorder is very crucial, and there's a high risk of people who are having adjustment disorder and is at the high rate of committing suicide. And adjustment disorder cases have been increasing, and the suicide rates are also increasing among women than in men. There are different ways to deal with and cure adjustment disorder using medication as well as counseling. The different types of adjustment disorder include adjustment disorder with depressed mode. Depressed mode, like the person will be feeling very sad. There'll be constant lapses of crying and feelings of worthlessness. They feel like they're not worthy of anything. They feel they're very hopeless of their life. And also they might have constant bouts of crying, and also self-harm and a lot of negative thoughts as well, is adjustment disorder with depressed mode. The next one will be adjustment disorder with anxiety. The person feels extreme worry, extreme tension, overwhelming thoughts, not able to concentrate, or there's a lack of concentration and memory and attention. Then there's adjustment disorder with depression and anxiety, where both depression and anxiety features are persisting as like a mixed emotion. Then adjustment disorder with disturbance of emotions and conduct. Basically, behavioral issues like stealing or creating fights. This is seen in teenagers or children where they are experiencing very impulsive behavior like rashless driving and impulsive acts, very violent and ruthless behaviors. This can be seen in adjustment disorder with disturbances of emotion. Then comes adjustment disorder unspecified. This is related to physical symptoms like related to having fights in school, or when teenagers and adolescents don't know how to behave properly, or they have constant fights at home. This is when adjustment disorder with unspecified disorder. So these are all the symptoms related to adjustment disorder. There are various symptoms like psychological as well as physical symptoms that can be arising due to this disorder. The therapy or the medication that is related to adjustment disorder includes having to increase benzodiazepines like antidepressants and giving them proper medication, along with therapy, which includes psychotherapy like CBT, where you constantly tell them, or you constantly have a therapy regarding behavioral activation where you replace negative thoughts with positive thoughts. You also educate them on how this can be cured using motivational training and also a lot of CBT and interpersonal therapy. You also give them emergency psychological care. They can be given psychological family help groups or support groups to initiate, to make them feel better about this disorder. So, along with medication and counseling, this can be cured, and they can be treated normally. And if anyone who is undergoing an adjustment disorder, they should be immediately gone to a specialist and undergo treatment, and they can be believed that this will be cured using medication and therapy.